have a nursing shortage problem, we have a nursing retention problem, and I'm here to solve it. Welcome to the New Nurse Boot Camp, where I teach new nurses how to stay in their career longer, don't get burned out, and have clarity to their career. All right, so today we're going to talk about who's on your team. So a lot of times we just talk about nurses or coworkers, but actually when you're at work, you actually deal with multiple of roles. So let's go over them. Yes, you have like your nurses, you have your charge nurse, you have your resource nurse, and then you have your doctors. So even within the physician team, you're going to have doctors, you're going to have NPs or nurse practitioners or PAs that work with them. And so these are who sometimes you're going to report to when there's a status change, or even if they're doing rounds and you need a new order. So your physicians, your nurse practitioners, and your physician assistants, these are people that you need to become familiar with, know their phone numbers and how to reach out to them, and even who's on call after hours. Your CNAs or personal care techs, of course, you work right beside them. I feel like your shift goes better when you and your tech are working together. They can make it easier for you, or they can make it more difficult. So you always want them to be on your side. And plus, teamwork makes the dream work. So why have a hard day? All right, next we have our pharmacists. Pharmacists generally are making rounds as well if you're in critical care, but also you have the pharmacy for medication. You can always call them if you have a medication question, if you have a question about compatibility, or sometimes they're just a really good resource for different medications if you kind of want to learn during your off time. Now next, the social worker. So the social worker generally has an office off the unit, but they will go over the admissions and discharges. You'll see them make their rounds and they'll ask the patient of, well, who do you live with? Do you need certain resources for food, mobility, or even housing? And so they're part of the care team because they make arrangements for how the patient is going to function after discharge. Now, your respiratory therapist. We don't talk about respiratory therapists enough. They're a big part of our team, especially with everything going on with respiratory season to COVID. But just on a day-to-day basis, respiratories, they come in, do our nebulizer treatment, they do oxygen therapy, of course, intubation and extubation. So it's great to actually work with your respiratory therapist and actually ask them a lot of questions. Most of the time, they're willing to teach you. And then lastly, but not least, physical therapy, occupational therapy, and the speech therapist. These are generally 3 separate disciplines, but they most of the time show up at the same time.